Welcome to MOOC series, an initiative started by LG University. This is Kaushika Patel, Assistant Professor from the Department of Pharmaceutical Technology. In this session, we are going to discuss about what are the different types of powder dosage forms and how you have to dispense them. Okay, so let's begin with our session. There are different type of powder dosage forms as we discussed in the first part. Now, what is the difference between those powders that we have to study today? So, first of all, there are divided powders. If you are going to use powders internally, then there are divided powders and there are bulk powders. Okay? In divided powders, you are given an accurate dose in the formulation and you have to take that dose directly at a time. Many such doses are dispensed in the package. So now when you have divided powder, there can be simple powder or compound powder based upon their composition. In simple powder, you have only a single active ingredient and that active ingredient may or with or without diluent is dispensed in the formulation. Example, if you have aspirin powder, then that is a simple powder. Then there is compound powder. When it is compound powder, there is at least more than one medicament in the formulation. So there will be minimum 2 API in the powder. So if you have aspirin, paracetamol and caffeine powder, then it becomes a compound powder. Then there can be bulk powders for internal use. When you have bulk powder, the entire bulk is dispensed in a single container and you have to measure the dose yourself at the time of administration. So such formulations, they are given in a single container and they are dispensed with a measuring device. Okay. Then there are bulk powders for external use. Such formulations, they are to be sprinkled on the skin or they have to be inserted into the body cavities. Such bulk powders, they are dusting powders, insufflation, snuff or dentrifice. So dusting powders, they are the finely divided powders which are to be sprinkled or dusted on the external part of the skin. There can be two types of dusting powders, medicated or surgical. Now, when you have medicated dusting powders, it is preferred for the superficial skin condition. So, there is one active ingredient, there is one lubricant and one absorbent in the formulation. They cannot be applied on the broken skin or the open wounds. But when you have surgical dusting powders, they can be applied on the deep cuts, major wounds, burns, or major surgical portions or the umbilical cord of the infant. In such case, the powder must be sterilized before use to prevent any cross contamination or infection. Then insufflation. Insufflation is an extension of dusting powder. But dusting powder, they are sprinkled externally. Insufflation, that is inserted into the different body cavities like nose, throat or ear. You will require a special device, that is insufflator, to insert that insufflation at the site of administration. So you can get a local effect or systemic effect by using that insufflation. This is the insufflator with the help of which you can insert the insufflation. Then there is dentrifice. Dentrifice is used to clean the teeth or the oral hygiene. It can also be used to deodorize or remove the bad odor from the mouth. It can be available in the form of powder or that powder can also be used in the form of gel, paste or foams. Then special powders which require special dispensing techniques. So we will see each one of such powders separately. First is effervescent powder. As the name indicates, such powder will produce effervescence in the presence of while you are going to take that administration, you are going to take that formulation. So it contains base, that is sodium bicarbonate, and acids, that is citric acid and tartaric acid. When they are added to water due to acid-base reaction, carbon dioxide gas is evolved and that gas leads to effervescence. This effervescence helps in many ways, like it will stimulate the gastric acid secretion that improves the solubility of the drug, or it can mask the bitter taste of the drug also. And the slightly acidic taste will make it more palatable compared to the simple powder. Such powders, they can be supplied in bulk or they can be supplied in divided form. Now the same powder you can convert to granules, because powder it leads to uncontrolled effervescence, but granules when you will form, they lead to controlled effervescence and proper administration by the patient. You can prepare such granules either by a heat method where no solvent or granulating agent is added, or by using the wet method where an extra additional granulating agent is added to form the granules. Then there is potent powder. Potent powder contains potent medicament which is effective in very small doses. Such medicament, when you are preparing in the formulation, the major issue is you have a very small quantity of drug which you have to add or mix with a large quantity of diluent. That's why proper mixing technique is required. For that we will go for geometric dilution method, in which stepwise dilution of API is done with the diluent. So example is hyaluron hydrobromide potent powder. Then there is hygroscopic and deliquescent powder. Such powders, they are sensitive to environmental condition, so you have to take care in dispensing such powders. Hygroscopic powder, it reacts in the presence of moisture and it converts to damp mass, whereas deliquescent powder, it reacts with moisture and it converts to liquid mass. So what are the remedies while dispensing? You can use a suitable absorbent or adsorbent that can absorb the moisture if it penetrates in the formulation. Then you can dispense such powders in granular form so that the overall surface area is reduced and the interaction of the powder with the moisture can be reduced. You can double wrap the powder by using environmental sensitive packing papers, and you have to store such powders in dry place where humidity is less. Then the next special powder is EUTECTIC powder. Such powder contain two or more such ingredients having low melting point. When such two ingredients having low melting point react with each other, they lower the overall melting point of the formulation below the room temperature, that leads to the formation of damp mass or liquid mass. To prevent such interaction, you have to take special care in dispensing. So phenol, menthol, camphor, any such ingredients, they lead to EUTECTIC powder. So what are the remedies? You have to use an absorbent or adsorbent that can absorb the moisture. While preparing the formulation, you have to keep both the ingredients separate, and then you have to mix them with the absorbent separately, and then finally you have to mix them lightly by using a spatula. You can double wrap the powder and store it in a dry place. Then powder for reconstitution. Such powders, they are supplied in powder form, but at the time of administration, you have to dissolve this powder in the boiled and cooled water and then take it immediately. The basic purpose of such powders is to enhance the half-life or the shelf life of the formulation so that its stability can be improved. Because many liquid formulation drug in the liquid state, it leads to chemical degradation faster. So if you will supply them in powder form, their shelf life can be extended. Okay, so these are all the different powders which are what are their composition and how you have to dispense them. I hope you have liked the session. For more updates, please subscribe our YouTube channel Pharma Ignite. Press the bell icon for the further notification. Thank you.